This meeting is a momentous meeting, long awaited by both sides, and particularly for the ministers who have just run through a course of the Federal Executive Council and are here. We thank all of you for coming here. We also thank the NMA and the affiliates and JOSU and the affiliates, because even though we've proposed this meeting last week, we just gave the invitations out just on Monday. So for those who traveled out outside Abuja to be here, we welcome you and thank you for this. Our meeting today is in furtherance of the Memorandum of Understanding, which the Federal Government of Nigeria and the health workers signed in end of April 2020, in the wake of the COVID-19 pandemic. The Economic Sustainability Committee of the federal government, headed by the Vice President, without prompting from the health workers, initiated the meetings which we held in March and early April that culminated in the signing of that MOU. This was done because the federal government of Nigeria realized the importance of health workers in Nigeria. And so without prompting, they decided to look at the welfare of the workers fighting the pandemic. We did our meetings in the private residence. That's in my home, because a lot of people were afraid even to meet at that time. But we braved it and met and fashioned out an MOU. We did an MOU that took care of the hazard allowance, which we felt was not commensurate with the hazards being faced by health workers. We looked at the protective personal equipment, PPE. Again, we took decisions on that. We took decisions on the group life insurance, at which the federal government initiated a life policy for all the health workers in her employ, and even extended it to other workers in the federal government establishments, ministries, departments, and agencies, especially those that are not treasury funded. Other issues discussed at that meeting included the extension of age for workers in the public service, health workers in the public service, the doctors, the nurses, physiotherapists, radiographers, and others. We agreed at that meeting and fixed some remuneration for health workers for 3 months in the first instance, after which we will look at our pulse and we will also look at the pandemic and know what it is doing before we take further action. But primarily, we said that we are going to fix a permanent hazard allowance because the 5,000 per month was obsolete and was no longer very relevant to the health system. So, in consonance with that MOU. The federal government had been meeting on the federal government side with a view to preparing for a meeting such as this. We also thank the health workers because they themselves, they did not go to sleep. They also were asking us, when is this meeting going to hold? And proactively, my ministry decided to meet with some of the workers when they came calling. Unofficially, the NMA came calling, the remunerations committee. Unofficially, some pharmacists also came calling. Some other persons, nurses, midwives came calling. And we told them we are going to have this meeting, that there is no question of government reneging on this MOU. So we are prepared on the government side because the federal government has put in place a presidential committee on salaries because there is a wage freeze. There is a freeze on salaries, and there's even an embargo on employment because of the astronomical rise of the personnel costs in the budget of the Federation. So this meeting is a meeting called in the spirit of what we did last year. What we did last year was done in a very good spirit. We did not see the unhealthy rivalry that usually exists in this sector. Maybe everybody was afraid that it could be a victim of COVID-19, so everybody decided to behave well. So we held meeting without rancor. It is that same spirit that I want us to adopt today. We don't have to engender any rivalry. We don't need it in this meeting. In fact, the meetings in 2020, each of those meetings ended after about 2-3 hours. And we formulated, in fact, the 1 hour on top of the last one was, or 2 hours was for the MOU to be fashioned and read and corrected and the rest of them. So we expect that same spirit. The federal government is desirous that the health sector be fortified. And a lot has been done in that direction. If you look at the budget, apart from the budget of the Federal Ministry of Health, which has statutory, you go to the COVID budget, health got a very big chunk of the COVID budget. And some of the spending still in health were extra budgetary from that COVID-19 budget. Typical example, 20 billion was appropriated in the COVID-19 budget for payment of the hazard allowance that we had projected at the time. But during payment, we discovered we could not even complete the second month and the third month. So he and the Minister of Finance, they had to run around. I don't know where they got the money from. My job is not to search for money with them. We agree on spending, they go and search for the monies. But I know we spent close to 32 billion in the health sector. And even at that, some people like medical people in the university clinics and even State House clinic were say complaining that they didn't get from that particular pot of soup. So we asked their employers to look elsewhere to get money for them. So we spent close to 32 billion to honor this agreement we had with you. And I want to say that our discussion today should be robust. We will asked the government side to give us a picture of what they're thinking. Then the associations and unions will then give their proposal. And after giving the proposal, we'll both retreat and go and digest what has been presented and reconvene. So if we do it that way, we will not spend too much time haggling or debating. Luckily, we have people of diverse experience here, on your side and on our side. The Commonwealth Medical Association President, Dr. Nebulule, is here. We worked together earlier on in the Senate, when we were in the Senate. He's also now coordinating African medical. And on this other side, people who have also worked elsewhere. So we want to be sincere and honest in the discussion. Because another side of the coin is that our revenue has dwindled very much. Oil has moved, as you all know, from $120 a barrel about 6 years ago or 7 years ago, to 40, 50, even sometimes 20. During COVID, we couldn't sell. So some of the funds being utilized were funds that were borrowed. So it's important we have that at the back of our mind. Oil also, the volume has dropped. We used to do 2.2 million barrels a day. Today, 1.5, highest. At a point, it was 800,000. So we have to look at all this holistically and discuss meaningfully as people of the same country. There is no we and them in this particular matter. It's a discussion that we have to do in the interest of our country first, and then so that we can also be alive as workers. Everybody here is a worker, and a worker will also take his compensation. So on that note, I want to welcome everybody again, and thank you for coming.
Allow me to rest from here on the protocol so well established by the chairman here, in the interest of time, and it is not out of disrespect. I join him in welcoming all of us here to this meeting, very important meeting. It is a continuation of conversations that have been going on before. Dr. Adeleke Mamora has been very much involved in these conversations in the interest of the Ministry of Health, as has been the permanent secretary. Much of what I have to say is to echo what the chairman, Dr. Mbige, has said. It is that this meeting here is a meeting that brings together interest groups of one country. Whether you are government, you know that all of you are either part of government or you are potentially going to be government. Whether we are government, we were once people also looking to government. Therefore, we are one people. We are helping ourselves to help our people. We are working in the interest of our country. We are not working for any foreign country or any foreign interest. We are working for our own people, our own citizens. Our brothers and sisters out there are the ones who benefit or lose from whatever we do here. It is in that spirit I want to again continue to say that our sector, the healthcare sector, is a critical sector. And I always like us to hold that at the back of our mind. If schools, teachers go on strike, you close and go away. You can come back after several months. The damage is measurable in absence at school. If a factory worker goes on strike, you can shut it down and wait. After some months, you can get back. But the health sector can't afford that luxury. And those of us who have committed to work in the health sector must know that and bear that at the back of our mind. It is not just a social responsibility, but a moral responsibility. I am a strong supporter of jawing, no matter how long. I do not support war in the health sector. We can judge, no matter how long it takes, we shall reach some agreement. And we do not need to take the risk of putting people's lives in danger, because it's painful, you can't return a lost life. So the Honourable Minister did mention that we are looking after our own interests here, our interests to help ourselves in the question of first providing as good a working environment as possible. The impact of COVID-19 is not only on Nigeria, it's on the entire world. And I'm a very good student of what is happening in this country and other countries. I'm constantly comparing. And I can tell you that in other countries, they're not having it any better than us. But there's a sense of nation, a sense of saying this is our problem, a sense of people saying we have to solve this, a sense of people who have retired coming and saying let us go and work for our country because our people are the ones involved. It is that sense that I want us to develop, to know that if things go wrong, all of us lose. And if things go well, all of us win. We have tried everything we can to take care of ourselves, providing PPEs. As you all know, we are in the dark side of all of this because we do not manufacture anything. We have to import. And the importation is not something you can just go to the shelf and pick. So we need patience in all of this while we are working hard at it. And we have been lucky that we have been able to do enough to provide these safety materials. The same thing for the hazard allowance, which spontaneously arose, in which we said, some people here will be exposed to risk. Let us make sure we recognize that fact. Same goes for the group life insurance, which was in fact also extended to volunteers, those who volunteer to keep out. So all this I'm saying in order to demonstrate that the goodwill is present in the side of government. But we're working with government, and government has its own ways, has its own working. It's different in every country. And we must live with the working of our own government, the way our government works. So we have proposals, we set them up, how easily and how quickly they come out, they come into fruition. It's not always within our own power. We need to be able to have the patience to say, yes, this is the way our government works. We work with it that way. Until the processes change or alter, we have to accept it as it is and work within it. And have the patience. Sometimes we need to be long-suffering in this. And I must say that, I'm not saying that I do not understand the meaning. I do understand. But sometimes we need to be long-suffering in tolerating the way our government works and working with it to show the necessary patience till remediation of complaints come out. So insofar, the Honourable Minister has also made it clear that during all this period, the economies of most countries were in difficulty, and the hospital systems. Right now, The so-called third wave is hitting some countries. We are praying it doesn't come here. I had a long conversation with the DG of NCDC last night, and we are still looking very closely at the risk factors we face. I also was looking at a report from Brazil, where in Sao Paulo they said they're overwhelmed. Their hospitals are full. There is no more bed in ICU. Other countries are suffering, but it's their problem. It's not just the problem of that government. It's everybody, including health workers, everybody. So in the same way, the problems here are our problems, whether we have 0 cases, 1,000 cases, it's our collective problem. It's not just a problem of government, because all of us here, all are government. So the revenue has crashed. We have to, in his own words, search for money, search for. That is exactly the word. And if searching for what again, for that money is also a collective responsibility. Although government takes the lead, we own government. And you here, everybody here owns government. So that level of understanding is there. And for us in the health sector, we cannot do without empathy, without compassion, which goes with the very, very essence of healthcare service. If you're in the health sector, you have to have a good dose of compassion and empathy with people who are suffering. So that is my own contribution, that we have the patience to go through the whole of this conversation and negotiation, that we have an understanding, that we display the necessary tolerance and, let us say, consideration for each other, and put the, well, what my colleague here called rivalry, to put that aside. We're all marching in the same direction. So therefore, these are my comments, and I do hope that with softened hearts and better understanding, we shall reach the understanding. I mean, it may not be 100% satisfactory, but let us all understand that if the glass is halfway, we say it is half full. We do not say it is half empty. And if we have that spirit of being able to say, yes, it is half full, we shall have satisfaction. Thank you for your attention.
And we eventually are holding this meeting. And it's a good thing that we are holding this meeting based on 2 factors. First, we care for patients. And we are very, very worried and concerned about our patients. It is for the patients that we are in the hospital. And we want to deliver quality service to our patients and to Nigerians. And therefore, we in the NMA are usually very, very concerned about issues that would disrupt these services in the facilities. The common men and women would suffer. Therefore, we try to do as much as we can to be proactive in medicine. We have preventive medicine and curative medicine. And we are told that prevention is better than cure. And it is in this light that the Nigerian Medical Association always goes to ensure that we are proactive, so that we prevent issues that will disrupt the services of the hospital, which we are not happy about at all. We are not happy because we are trained to look after the sick. And also those who are even well. There are some people who are very ill, but they do not know that they are ill. It is through the services of the doctor that they probably on routine check would see that they are not well and they need to be treated. So that is where the Nigerian doctor is. In doing so, the Nigerian doctor needs to have a conducive work environment. And we need that very seriously. And other health workers, so not just the Nigerian doctors, but here I'm representing the Nigerian Medical Association. So we need conducive work environment. We are concerned about what is happening in the health sector, that Nigerians move out on a daily basis to other countries where probably their services are better needed. This is like a cycle. It happened about 1978 to about 1990. In 1992 to 1996 it happened. And this one is like an immigration. Previously it was the very senior ones that were going. Now it is a spectrum. The young, as soon as they finish, they move. The not too young, they move. The old, they move. We need to do a comprehensive research and find a lasting solution. Otherwise, we'll be scratching the surface. We believe that Nigeria has what it takes to provide the best services for its people and for others to come in. So that instead of having this medical tourism with immigration and, of course, waste or loss of foreign exchange, we need people to come to Nigeria. And that can be possible only when we have the facilities, where the work environment is conducive, where everybody gets what is due or her due. And therefore, this meeting should be, in my opinion, should be quite holistic. We are here to look at the issue of hazard allowance. I actually do not want to talk about 5,000 because I feel very pained that we're talking about 5,000 naira as hazard allowance, even at the face of severe risks to our colleagues. 5,000 naira. And I have told people that nobody should hear that doctors are being paid 5,000 naira allowance per month as hazard. Nobody should hear that. And I pray that we don't mention it because it's not good enough. I also think that instead of going forward and backwards, we can incorporate the issue of retirement age so that we then have a holistic approach to this. There's no doubt that those who are going are not being replaced. Even those who are in, they don't have a place to work. We heard there's been embargo on employment. Meanwhile, the requirement for those who should provide service is huge. The gap is very huge. Again, it requires data and evidence. And this can be done very quickly by the Ministry of Health. So I'm happy that we're all here. We want peace. We want to ensure that we listen to one another. We are not on a rivalry mission. We are here to have peace. We want to talk to ourselves, not talk at ourselves. And in the end, I pray that God will intervene so that we'll have a peaceful meeting and we have acceptable outcome of this meeting. Thank you very much.
I want to clarify the issue of embargo on employment. It doesn't affect the medical and defense. They were given exemptions. The only thing is that they have to apply through the Ministry of Health for Health people and head of service of the Federation if necessary, so that they can be captured by the budget office of the Federation. I think that's the only thing. We have exemption of Federal Executive Council for medical people and defense and paramilitary for this period. Thank you. So, Chairman Ojosu.
7 days to 1 year. I want to, on behalf of Joesu, state clearly that our mission here, like has been requested and has been stated by others, is not a mission for combat. Everybody knows that the hazard allowance, present hazard allowance, standing in tune with the enemy president. I will not mention it because it is provoking. It's long overdue for review, especially when the crisis-provoking revelations have been made to us that even within the space of the Nigerian public sector, there are persons that are, even as we speak, are earning far above that bitter amount. It's really crisis-provoking. But however, today we are here to amend that oversight or omission that caused that provocative figure to remain till this day. Yes, there are some within the system today that have even a flat rate of 30,000 naira as we speak today. Yet, picking from the Honorable Minister of Health's position, that we need to show some empathy, compassion, and all the good things about humanity. And it is the same health sector and health workers that are seen to be critical people that have been punished for this long. With that figure that I have also enlisted not to mention. Sir, for Joesu, we have shown compassion, empathy, and whichever humane status that is expected of us, even since 2017. And recently, since last September, when we suspended our action, that we would have been called back to the table to discuss issues, but we were not till this day. However, today is not for that. And I know at AOB, we will also try to bring some of those perspectives in for us to see how we can, as a whole, deal with the situation on the ground. Even if not as a finality, at least some level of empathy. We're expecting huge level of empathy, compassion, and love to be shown by the government side. So having said that, let me close with this again to say, even the retirement age itself is long overdue for an upward review, even in the health sector. Because, again, the so-called critical health sector is denied this, but so many sectors within the public service system have been given that privilege. There are some that are 70, 60, 65, 70, and recently too, some people were also given 65. So the critical health sector should be treated as a critical sector by giving that speedy approval of that, because every health-trained personnel is trained for a longer period. And for you to move from one point to the other, you still need to go and advance your training. So given all this, sir, I think delaying that retirement age issue is denying the health workers good time to stay and give service to the nation. Even though you said the embargo did not affect us, I'm very, very aware that those who retire largely outweigh those who are employed on application. With that, I say thank you and God bless you all.
Just a brief one, sir. We would like to know the final outcome of this meeting.
Oh, very fruitful meeting. You can see everybody smiling. All the professional bodies are here, in the professional bodies in the health sector. Doctors, pharmacists, nurses, radiographers, everybody, we're all here. The medical doctors were led by NMA. There are 4 affiliate unions, and the other professionals too were led by Johesu. They had a leadership, each of them. So we received the proposals from all the union association, and they have also seen and noted the government position on their submission, and we then agreed that everybody should go back, crunch the figures we have, the various proposals, and we'll reconvene in 3 weeks' time.
What proposals are the head workers bringing?
Well, they're bringing percentages of the increments they will need on the existing hazard allowance. And there was a proposal for block money, lump money, and a proposal for percentage of. So these are things we are putting on a weighted scale. There was also a proposal for age increase for the various workers, the medical consultants and medical officers, the pharmacists, and they want an increase to 65 years of age and consultants 70 years. So all have been, because there are all issues of personnel costs. So we're going back to Presidential Committee on Salaries.
Why I ask that question is that because we heard that some of the head workers are actually proposing that there should be 50,000 naira across board. Did any of them mention that during the meeting?
No. They brought in their proposals. This is the preliminary stages of the discussion. They agreed to go and modify whatever proposal they have and come back. We also agreed to look at the degree of risk. Not everybody is exposed to the same degree of risk. If I'm in an infectious disease ward, or isolation ward, my risk is different. If I'm in an ICU, my risk is different from the person in the hospital premises or the person in the normal ward. So these are the issues we ask people to go back. And government side, Ministry of Health will also go back and do some work on it.
All right. We understand that let me use the word health workers because both medical doctors and that submitted proposals or made proposals to the federal government on the review of the existing hazard allowance. What proposals did you bring to the table?
Actually, first I want to thank you, the press, for always trying to sing our song for us, make our voices heard. Actually, at the JSU platform, we had 2 options. One, we were looking at flat rate because we believed hazard does not discriminate. We also believed that the treatment for any infection contracted is also the same for all. So we had that as an option. Then the alternative option was that if the Congress is adjusted, then the percentage format should be taken. And to take it, we made 2 options there. One, we said the baseline should be, we made a proposal of 65,000 for level 1 to 6 as hazard per month. And then, because we know that as we speak now, while we are still earning 5,000 flat rate, there are still sectors that are earning 30,000 that are not health service sectors. So, and some, the lower side, earning 15,000. So we felt there should be justice in this. So we have said it should be 65 from level 1 to 6, irrespective of whether the Congress is adjusted or not per month. Then For CONES 7 to 9, we have asked if the CONES is adjusted, then it should be 80%. But if it is not adjusted and it's to be done, then it should be 90% of the consolidated basic. We also made a proposal for 11 and 12, which we said should be 80 if adjusted, if not adjusted, and 70 if adjusted. And then, so it went on to 13, 14, and 15, where we proposed 70 if not adjusted and 60% if adjusted.
So what proposal do you also present regarding the retirement age for health workers?
Yes, certainly retirement age, we have made our case very clear that 65 years for non-consultants and 70 for consultants. That is where we are standing. So because right as we speak, there are sectors that are not, in the that are not health sector, but they have already been given 65 years and 70 years. And we believe that for the length of period it takes us to educate ourselves from one point to the other, that we usually have very little time to spend in the service. And so, and again, with the non-employment employment embargo that has been placed, that we are filtering people into the system, those that are leaving are so much every year, and then it is increasing the ratio between patients and the health worker, which is now becoming a serious burden on us. And when the burden is so high, efficiency is also sometimes called to question, not deliberately, but because we are fatigued. That's why we are asking that should be, so that we can retain some more people and then use these very group of retained people to also build the upcoming and to make the gap. Because you remember there was an embargo for some time before it was temporarily lifted.
All right, thank you so much.
Thank you so much. Thank you.
Excuse me.